Hello, I'm Lisa Weston, nutrition consultant and Isogenics independent associate. Really interested in nutrition and every aspect of nutrition and how it works with overall well-being. I'm here today to ask a few questions of my friend Ariana, who is a naturopathic osteopath, about aspects of functional medicine. So Ariana, what is functional medicine?
Hi Lisa, thank you for joining us today. So functional medicine is a shift in a therapeutic approach from being very much symptom focused to moving to a whole person focus. So we're treating the whole person, we're not treating symptoms. So in doing so, we're looking at factors such as environment, genetics and lifestyle, and see how they may be contributing to the health concerns of our patients.
Very good. And how long is a consultation generally?
So a consultation is usually 2 hours long, sometimes longer, because patients come to us with sometimes many conditions and we're not on a timer. So it's very different from perhaps what they've been used to before. And we take time to listen to their story in a very relaxed environment.
What happens during a consultation?
So we start with taking a really comprehensive case history, and that could range from birth up until now and cover many topics. And then part of functional medicine as a consultation is that there's going to be a health screening. So we run the scan for the patient, and the outcome of the scan gives us pointers in terms of health risks, which we feed into our overall assessment. And then we can start preparing a treatment plan.
Very good. And what then is the usual outcome of a functional medicine consultation?
So at the end of the consultation, we are going to agree on a treatment plan. And that could cover various aspects of really the person's life, whether it's lifestyles, adjustments, whether it's recommendations in terms of therapies such as osteopathy, nutritional therapy. So this is where you come in, yoga therapy, mindfulness, etc. So it's not about selling one therapy. It's about what is right for the patient, and it tends to be a multifaceted approach. We have that treatment plan, which has to be achievable, and then we essentially we're going to be following up with milestone scans and make sure that the patient keeps on track, whatever the health goal was.
Okay, and what sort of patient would functional medicine be appropriate for?
Yeah, so that's a great question, because it's not for everybody, because a patient should be prepared to be asked questions about their health, perhaps more in depth than they used to. So it could be anything about their digestion or gynecological issues, if there are any, to their childhood and any past traumas, any patterns of ill health. So even though the consultation is not physically invasive, the patient should be prepared to be happy to share those experiences. Therefore, the ideal patient is someone who's really accountable and into preventive health and wants to actually take action and perhaps take drastic actions to change their lives. It's perhaps not so well suited for a person who takes a bit of a backseat approach to their treatment, perhaps looking into a magic pill or wanting manual therapy. Now, we can totally help with manual therapy at Signature Health Clinic, but functional medicine requires a lot of investment from the patient. And long-term commitment is important as well. So you're not going to be fixed in one if you've had 14 years plus, say, of any long-term issues. So it's about having the commitment to yourself to be coming back to check on progress. But there's a lot of hand-holding as well, as much as a person needs. So, it should all be achievable because it's all been agreed in advance already.
Excellent. Thank you.